I'm Natalie Kunsman, MD, and today we are talking about lupus per request of one of my very near and dear friends who reminded me it is also not only Lupus Awareness Month, but today in particular is Lupus Awareness Day. So, who can get lupus? Well, there are certain people who are at higher risk, and in particular women of the childbearing years, age 15 to 44. There are certain racial or ethnic groups, such as Native American, African American, Asian American, Hispanic or Latino, and the Pacific Islander sect. Now, people who have a family member with lupus or another autoimmune disease are obviously at higher risk as well. Keep in mind, people with a leaky gut, people with a high inflammatory diet, people with toxic exposures or other autoimmune disorders give you a higher propensity to contract lupus. People with food allergies and sensitivities, people with a methylation disorder, people who have had exposures in high EMF field, people who have a mitochondrial dysfunction or a glutathione deficiency are also higher risk for lupus. There is also a ratio such that those that have a higher omega-6 to 3 ratio have a higher risk of lupus, and those who have an upper cervical subluxation. So this is a very integrative look at who might be higher risk for this disease. So how does lupus present? Well, people might notice extreme fatigue, or a lot of pain or swelling in the joints, headaches, swelling in the hands, puffy eyes, a sensitivity to sunlight or maybe even fluorescent light. Lupus patients might experience a lot of chest pain with breathing deeply. And a lot of people with lupus will have skin and hair disorders such that there is a classic butterfly-shaped rash on the cheeks, which is called a malar rash. And those people might also notice hair loss, sores in the mouth, or fingers or toes turning white or blue and feeling numb. And this is akin to having Raynaud's phenomenon with the lupus diagnosis. Diagnosing lupus can be a challenge. I can tell you this from the years of seeing patients and the various ways that lupus has presented. So a lot of it may come in the version of blood work. So of course the CBC might be used, antibody testing might be used, and since there's a high propensity for clotting disorders, clotting studies may be needed, and complement testing. So I'm going to zero in on some of the most obvious of the rheumatologic blood work to help nail the diagnosis. Now, ANA antibodies are almost 98% found in a lupus patient. So we think this is one of the most sensitive tests to at least start confirming this. Now, there's different ways to talk about the ANA, such as the titer or how much of the antibodies are noticed, or the pattern of what it looks like, such as, for instance, homogeneous or speckled. And the homogeneous pattern seems to be one of the more common found in a lupus patient, but speckled can also be found. So there is anti-double-stranded DNA antibodies. That might be in about 30% of patients. There's an anti-Smith antibody, and that is found almost exclusively with people with lupus. There's an anti-U1-RNP antibody, and that may also be found. There's anti-Rho and anti-LA antibodies found in those with systemic lupus about 30 to 40% of the time, and of course it may also be found in those people that have Sjogren's syndrome. There are antibodies to the histones. As a reminder, histones are the protective coating, protein coat that we have surrounding our DNA molecule. So, all that being said, lupus can affect the skin. and make your skin more sensitive to the artificial or ultraviolet light. Sjogren's syndrome is also common with people that have lupus, and it causes your mouth and your eyes to be extremely dry. So the way to treat lupus, again, I will focus on an integrative approach to this. We'll start with the medicines because this is usually what needs to get started, especially in a severe case. Most of the medications are immunosuppressive, and they might be prescriptions such as cyclophosphamide or Cytoxan, methotrexate. And then we have an antibody test, which is belimumab, which is Benlysta. And these are designed at suppressing the immune system at a global level, but with the Benlysta, we're actually looking to block the inflammatory secretion of antibodies from a B cell, which will be blocking that antibody. Now, there are anti-rheumatic drugs, and one that we might know is Plaquenil, which is hydroxychloroquine. Then there is the treatment of the symptoms, such as the NSAID painkillers or steroids, which will globally try to block the inflammation and work at the pain level. Then we may need some blood pressure medications, or we may need some anticoagulants based upon the way that lupus may affect the vasculature or make the body hypercoagulable. Occasionally, since there may be a hormonal component, occasionally birth control pills may be used. Now, let's move on to the foods and the natural treatments, which will have a tremendous positive impact on the disease and work on the disease modification. So, foods that will aggravate lupus are gluten, added sugar, because it can overstimulate. High sodium foods, and this would be more if the lupus has affected the kidneys and created a lupus nephritis, so we want to keep the sodium levels reasonable. Now, trans fats and saturated fats, which you find in the fried foods, can lead to a lot of inflammation and a lot of heart disease, and people with lupus have a very hard time trying to metabolize these saturated fats. Alcohol and too much caffeine will certainly impact lupus, and it can cause the worsening of the inflammation or damage to the liver, or actually increase pain and diminished sleep. There are certain legumes which will bother a lupus patient, such as alfalfa, green beans, peanuts, soy, snow peas, because they have an amino acid L-cannabinine. Again, smoking, no smoking for lupus patients. Smoking makes that much worse. Now, going on to the foods that will heal lupus, we are talking about organic, unprocessed foods, raw vegetables to promote an alkaline body and reduce inflammation. And of course, it will increase digestion. We want wild-caught fish to provide some omega-3 fats to help reduce the inflammation. We want a high antioxidant diet, which will be rich in vegetables, leafy greens, avocado, asparagus, berries, and then we have the healing bone broth. We also would like to promote exercise to help the lupus patient, such as walking, gentle exercise, water sports, Tai Chi, and yoga. Lupus will do a lot better with low stress. We need to promote sleep to help with these patients. And of course, with all the skin manifestations, we need a lot of skin protection to protect from the light exposure. We need clean, filtered water. And as far as the natural pain management, we would like to look more so toward acupuncture, chiropractor, especially if we're working on the cervical subluxation, mindfulness, some essential oils, massage, and magnesium baths, again, and that's to help with the pain. There are some supplements that are beneficial. Obviously, a good omega-3 fish oil, at least to think about 2,000 milligrams a day. DHEA, which can help improve symptoms, but if we have to pump the dose, you need some medical supervision. We need vitamin D3, at least 2,000 to 5,000 IUs daily, and that will help to modulate the immune system and actually help lower some of the depression and anxiety. And back to the mitochondrial deficiency and fatigue that comes with these patients, we're looking at mitochondrial food. So that might be N-acetylcysteine, lipoic acid, CoQ10, and L-carnitine. There is MSM, which is a natural anti-inflammatory, which also improves the digestion, and that can be anywhere from 2,000 to 8,000 milligrams a day. And we may want a green superfood, which may have spirulina or chlorella to help slowly detox, but it will also alkalinize and it'll boost liver and kidney functioning. We have our friend turmeric, which works sometimes equal as a steroid drug. We have glutathione, methylated products. And we also need to make sure we keep our gut microbiome healthy. So that may come in the form of probiotics, but certainly considering the juicing and getting our veggies. For the energetic fix, let's make sure we practice grounding techniques. And as far as the spiritual involvement, get creative, have some grace, forgiveness, and let go. So again, this was our lupus discussion. If there are any questions, please submit them below. I am Natalie Kunsman, MD, and until we meet again, be well.